Hello, everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched the simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, how to create a training around it, or add it to the trainings that were already being held. To date, we've held 12 virtual screening events. We've engaged more than 1,000 participants, and we look forward to hosting many more events in this coming year. Tonight, we are thankful for you, our amazing CADCA members and guests, and we are specifically today thankful to our good friends and tonight's co-hosts, Arkansas Drug Director Kirk Lane and the entire team at the Arkansas Department of Human Services Division of Aging, Adult, and Behavioral Health Services. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers across Arkansas who are working every day to save lives. We are honored for them to be part of this event. Then we will view a virtual reality simulation that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Lastly, we would love your valuable input while learning from you all in attendance today how you would use this virtual reality format in your communities. From these events, we plan to learn how to roll out this technology nationally and what resources we may need to accompany this goal. So again, we'd love your valuable input. After we hear from our speakers and see the simulation, we'll have a few minutes for some guided Q&A. I'll ask a few questions at the end of the hour, and if you would please type your answers into the chat, we appreciate your input. Additionally, in the weeks to come, we'll reach out to you all as a group to get more input from you as well. And now on to our speakers. Typically, our next speaker is CADCA's President and CEO, General Barry L. Price. Unfortunately, he's not able to attend tonight's event. He did, however, want me to express his apologies for not being here and also thank you for the work and impactful collaborations you are achieving throughout the state of Arkansas. In lieu of General Price, I am pleased to introduce you and turn comments over to CADCA's Chief of Staff, Valentino Murphy. Valentino joined our team at CADCA almost a year ago, and he has jumped in with both feet. We're thrilled to have him on board, and we appreciate him being here today to speak with us. Valentino?
Thank you, Reiko, for your introduction. Our hosts, Chief Lane and Tanisha Barnes, have been great advocates and allies of CADCA for many years, and it's an honor to be on with them and other leaders from the great state of Arkansas. Kirk has been a longtime member of CADCA's board of directors, so it's always a privilege when we can work together on a campaign such as tonight's event. I'm excited about our partnership with Walmart, who has developed a virtual reality tool to deliver a powerful experience-based element to naloxone and overdose reversal training. It has been more important to know how to save a life, and everyone on this webinar is at the forefront of efforts in your communities. We are now entering a hopeful and promising stage in the country where we are vaccinated, boosted, and committed to having life return to normal. We must use this energy, this new shot of life, to stay motivated and create innovative and groundbreaking strategies to address substance use. Today's webinar is a great example of that. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse, and prevention has become more important than ever. Recently, the CDC reported that 107,622 drug overdose deaths occurred in the United States in the 12 months ending in December 2021, the largest number for a 12-month period ever recorded. To put that number in perspective, that would fill War Memorial Stadium in Little Rock 2 times over. This is tragic, and we have to do our level best to right this ship. As life returns to normal, it's important to work together as one. One nation, one goal, one CACA. One CACA is a call to action. It signals that the participants within this movement must unite and come together as if we are one, if we want to win. Together we are strong as we train substance use and misuse prevention to coalitions every day of the year. All across the world, we know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. You are the true heroes in the community. The conversation being held today on this webinar is not a unique one. Our partners at the Drug Enforcement Administration recently launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. Let it be known, if you do not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. Keep up the great work that you are doing. Look forward to seeing you in person the next time we are all together. Thank you for having me today, and now I'll pass it back to Reiko.
Thank you, Valentino. Thank you for those remarks. We welcome you and we appreciate you joining us tonight. And now it is my pleasure to introduce our speakers. I'm honored to introduce our first speaker, CACA board member and Arkansas Drug Director, Kirk Lane. Director Lane was appointed by Governor Hutchinson in 2017. Previously, Director Lane served as the Chief of Police for Benton, Arkansas. He has served on boards representing Arkansas for the Regional Organized Crime Information Center and was the chairman of the Arkansas Chiefs Association Legislative Committee. Director Lane is an active member of the Arkansas State Working Group for Prescription Drug Abuse Prevention, and he received the 2012 Marie Interfaith Leadership Award for his work in this area. Director Lane, thank you for being our co-host today, and I turn it to you.
Hello, I'm Kirk Lane, State Drug Director for the state of Arkansas, and we are excited to partner with CACA and Walmart to bring you this great educational and life-saving program. Arkansas has long been in trouble with the opioid epidemic, or as we say, opidemic, and led into this terrible and deadly scourge by a long history of opioid overprescribing. Arkansas is consistently lowering its opioid prescribing rate, and currently we are at the lowest point it has been in 17 years. But as we stand today, Arkansas still ranks second nationally for the highest opioid prescribing rate at 75.3 opioid prescriptions for every 100 Arkansans, almost double the national prescribing rate. Thus, we realize that this has caused us to have a very opioid-dependent population, fueling the migration to street opioids like heroin and illicit fentanyl. In 2019, Arkansas was one of 5 states to show a double-digit reduction in overdose deaths, listing 352 overdose deaths for that year. COVID-19 in 2020 led to isolation, depression, and reduction of support mechanisms. We also realized a large influx of illicit fentanyl into Arkansas, causing those overdose numbers to surge in 2020 to 547 fatal overdoses. In 2021, we are predicted to have just over 600 fatal overdoses. Analysis of these deaths revealed that a large number of them were due to polydrug overdoses, as we are finding illicit fentanyl mixed into other drugs like methamphetamine, cocaine, marijuana, and pressed into fake prescription-like pills. To combat these issues, Arkansas has increased its ability to use educational formats in all facets of prevention, treatment, and recovery, as well as enforcement efforts. Programs partnering with community coalitions, state and local government agencies, as well as businesses and associations to provide educational resources to heighten awareness and participation. Programs such as Arkansas Drug Take Back, Partnership for Success, Don't Run, Call 911, to name a few. Naloxone, also known as Narcan, was embraced as an immediate emergency tool to allow someone to breathe during an opioid overdose. Arkansas quickly passed legislation to provide access of naloxone without a prescription and protection from civil liability when using naloxone or an opioid antagonist to save someone's life during an overdose. Legislation like the Joshua Pauley Act was passed to provide protection for those that called 911 to be protected as a Good Samaritan. And most recently, Arkansas passed legislation mandating the co-prescribing of naloxone when prescribing certain level of opioids or noting that a person had a substance use disorder. The Arkansas Naloxone Project was formulated in 2017, providing naloxone training and naloxone to first responders, school nurses, treatment and recovery programs, and at-risk communities. This program has almost 1,500 documented opioid reversals to date. And partnering with the existing capacity of Arkansas EMS naloxone administrations, Arkansas has administered naloxone to 14,845 individuals since 2017. As you can see, naloxone has really been the difference between life and death during an opioid overdose. Reversing a deadly opioid overdose is quickly becoming a pathway to treatment and recovery, but it takes an all hands on deck approach to turn the tide. Please download Arkansas's free app, Narkansas, to guide you in this endeavor. And thank you for stepping up to be that needed hero in Arkansas.
Thank you, Director Lane, for taking the time to be part of this event. Thank you for speaking with us tonight and for your insight into Arkansas's fight against prescription drug overprescribing and overdose fatalities. Next up, we will hear from Tanisha Barnes. Tanisha Barnes is the Director of Prevention Services from the Arkansas Department of Human Services Division of Aging, Adult, and Behavioral Health Services. Tanisha has been a representative for the National Prevention Network for 6 years and has served as the Southwest Regional Representative, the Regional Vice President, a member of the NPN Internal Affairs Board, NPN Executive Committee, and Prevention Coordinator Advisory Group in past appointments. Currently, Director Barnes represents Arkansas on the National Prevention Technology Transfer Center Advisory Board, the PTTC, for the state of Arkansas. Ms. Barnes holds a Bachelor of Arts degree in Psychology and Sociology from Henderson State University and furthered her studies with a dual master's degree in Human Resource Development and Leadership from Webster University. We're so excited to hear from you tonight, Tanisha.
Hi, everyone. My name is Tanisha Barnes. I am so excited to join you tonight and tell you a little bit about our programs, what we have here in Arkansas Prevention. First, I want to thank CACA and Walmart for providing us with this educational opportunity. We are proud members of CACA and the training opportunity they have provided to the prevention workforce here in Arkansas. Now, the prevention workforce is made up of all aspects of prevention, building coordinated prevention efforts through coalitions, collaboration with state agencies, community organizations, and special populations, offering multiple strategies, providing multiple points of access, and allowing for coordination to expand citizen participation in community activities as most promising approaches to preventing alcohol and other drug problems and youth violence. Now, the opioid epidemic has empowered the prevention workforce to cast a wide net to educating on the dangers of ATOD, alcohol, tobacco, and other drugs. As the opioid epidemic continues to aid our state, we are focused on dismantling the epidemic by providing funding, which encompass contract management to community partners, colleges, universities, and other statewide partners. The division subcontracts with a variety of contractors to ensure substance abuse prevention services are available to all Arkansas citizens. For the purpose of a seamless service delivery, In reporting, the state is divided into 13 regional regions. Each region has a prevention regional provider, which is staffed by a regional prevention representative that offers training and technical assistance to communities, partners regarding prevention needs and solutions. Prevention services also subcontracts with other local and statewide and out-of-state contractors with other prevention services, including over 50 substance abuse programs. One of the things we're looking to do to put on the college campuses is called the Nalox Box. The Nalox boxes are put there because we wanted to provide education and also the administration of Narcan on the college campuses. We're looking to put those in dorms, sorority and fraternity houses, as well as athletic facilities across the campuses. Now, our goal in our needs assessment told us that we need to target this demographic by putting it in college campuses because we knew we did not have the data to support or the Narcan, so we figured we needed to touch this population. And how we're doing that, we cannot put the naloxone on the campuses without providing education. So what we decided to develop with our state partners was a collegiate Narcan training, which is on the Arkansas Drug Takeback website. Now, one of the other things that we have, which I talked a little bit about the regional prevention reps that are across the state of Arkansas that are cut up into 13 regions. They're also been trained in Narcan training that we have trained them with a TOT, which is train the trainer. They assist in training facilities, treatment centers. Also, they teach and train communities, local and state, if they're needed. Faith-based communities, they're out there training them on naloxone. So you'll hear a lot about this one thing that we are excited to talk about, which is Narkansas. Our Narkansas app, you'll hear that through Criminal Justice Institute with one of our state partners that will speak on that as well. So the goal of prevention for us in the state of Arkansas is to educate our citizens, empower communities, encourage collaboration, and enhance prevention efforts through communities, mobilization of fostering a healthy and positive environment for this great state of Arkansas. Now that's our goal and that's our mission. And we thank you for having us.
Thank you, Tanisha. We are so fortunate to work with you in these and so many other initiatives. Thank you always for your work and your passionate work in Arkansas and for your support of CADCA, and we are so proud of our friendship with you. Now we will turn to hear from Dr. Cheryl May. Dr. Cheryl May was appointed Director of the Criminal Justice Institute in the University of Arkansas system on July 1st, 2010. She has served and been an advocate for the Arkansas law enforcement community for more than 39 years as a forensic professional and as a Criminal Justice Institute Chief Executive Officer, Deputy Director, Assistant Director, and Program Manager. Since 2014, Dr. May has served as Chair of the Division of Elementary and Secondary Education Safe Schools Committee. Dr. May has served as a member of the Board of Directors for the National Alliance for Drug Endangered Children and chair of the First Responder Subcommittee of the Arkansas Legislative Task Force on Autism. She was also appointed a member of the Arkansas Task Force for the Prevention of Human Trafficking. Dr. May played a lead role in Arkansas becoming the first state in the U.S. to develop and implement a statewide certified child abduction response team. We will now hear from Dr. May, who will talk to us about how the Criminal Justice Institute is ensuring stable and effective overdose prevention programming across the state.
Hi, I'm Dr. Cheryl May. I'm the director of the Criminal Justice Institute. We're a part of the University of Arkansas system, and we're very, very proud to have been a long-term partner in a series of grants that the Arkansas Drug Director's Office and the Department of Human Services has acquired from SAMHSA. I want to thank Walmart and CADCA for focusing on this event. As so many of us know, the number of opioid overdose deaths happening in this country continues to escalate. And in order for us to really get the kind of handle that we need on these deaths, it's going to take each and every one of us. So we're very, very grateful to be partners in this initiative. The Criminal Justice Institute has been working on this program since around 2016. And the grants that we receive, as I said, come from the Drug Director's Office, but the federal partner is SAMHSA. We call it the Arkansas Prescription Drug Overdose Project. And with particular reference to naloxone, our particular component focuses on providing naloxone kits, training, and other parts of a program that I'll talk about in a second to first responders, which would include law enforcement, fire, and EMS, as well as what I like to call families in recovery. These are individuals who are completing a treatment cycle. And as we all know, once they come out of treatment, especially now, since there's the potential for fentanyl to be found in any kind of drug that's being used, these individuals are particularly at risk for overdose. So we focus on their family and support system and to be able to provide them with the training on how to administer naloxone and then also the naloxone to take with them. Our program is geared, as many of us know. You never know when you're going to end up finding somebody that is overdosing. We are a tremendous supporter of naloxone. We've seen it save over 1,450 lives in our state based on the work that we've done. But we also know that these individuals that are being saved are our sons, our daughters, our husbands, our wives, our moms, our dads, our neighbors, our coworkers. There's absolutely no socioeconomic barriers to this scourge. And so by getting as much naloxone as we can out there, we can at least take the first step in saving the person's life. But I think it's also critically important that we understand that once their life has been saved with naloxone, we need to do everything that we can to get these individuals in treatment and eventually recovery so that we can ultimately save our lives. We've been very fortunate through this funding to have provided these services to 47 what are considered high-risk communities within the state of Arkansas. We have 75 counties, so we haven't been in every single county, so we still have a lot more work to do, but these are considered to be high-risk counties. We go into these counties and we talk about naloxone and how important it is, and we talk about the specific data that are based on their own local community. And we try to bring in all key stakeholders that are going to be participating. And then we work with the first responders, fire, emergency management, and of course, law enforcement. And we have them develop policies that talk about how they're going to actually administer naloxone, how they're going to store naloxone, how they're going to make sure they're going to replace it when it ends up expiring. And then we also require them to have a what we call a memorandum of understanding with a licensed physician within their county. That's necessary because we want the physician to be able to look at each and every administration that's made and to determine if they actually did it the appropriate way. Then when we were initially developing our program, we realized that, like all funding, there may be the day that this funding is no longer available. And so we wanted to make sure that they had a physician in place that could order replacement naloxone for them. So we're very excited about the number of saves that we've had. And we also do a community prevention piece so that we can also have an impact in this community. But we're very grateful to have this opportunity, and we're thrilled to be able to work on a significant project like this.
Thank you for those remarks, Dr. May, and for helping us understand all of the thought and effort going to these programs. You are doing amazing work, and we are grateful. Now we'd like to turn it over to Jamal Williams. Jamal manages the Administration First Responder Comprehensive Addiction and Recovery Act grant to provide naloxone training and resources to first responders and members of other key community sectors throughout the Arkansas Delta region. The naloxone program builds effective overdose prevention and referral services, including naloxone distribution and training. Jamal has a passion for public service. He strives to utilize his skills and experience in grant administration and communications to bring an intensely creative approach to transform ideas into visual statements that successfully reinforce public awareness and generate engagement. Jamal holds a bachelor's degree in computer graphics and interactive media from the University of Dubuque. Jamal?
My name is Jamal Williams, and I am the project director for the First Responders Comprehensive Addiction and Recovery Act grant, serving in this position with the Arkansas Department of Human Services, Division of Aging Adult and Behavioral Health Services. FCAR conducts an education initiative to reduce prescription drug opioid, overdose-related deaths, and other problems associated with opioid use disorder in Arkansas's Delta counties. Through partnership with the Criminal Justice Institute, we are providing life-saving resources to communities combating drug abuse and opioid overdose-related deaths through the Arkansas Naloxone Project. This initiative, which began in 2020, strives to train rural law enforcement agencies, fire and EMS organizations, school nurses, librarians, and treatment and recovery facilities on how to correctly administer naloxone. Upon completion of this training, participants will receive the FDA-approved naloxone used to reverse the effects of opioid-induced overdose. The Arkansas Naloxone Project is a partnership amongst the State Drug Director's Office, Department of Human Services, and the Criminal Justice Institute, along with hundreds of trained first responders. This work is supported and made possible by SAMHSA, the Substance Abuse and Mental Health Services Administration. In addition to this, we have the UAMS Reynolds Institute of Aging, Opioid Prevention for Aging and Longevity, the Reynolds Institute on Aging at the University of Arkansas for Medical Science, in collaboration with the DHS, Division of Aging Adult and Behavioral Health Services, through a grant also supported by the Substance Abuse and Mental Health Services Administrations, developed a program curriculum on opioid use disorder awareness to provide OUD awareness curriculum training to our healthcare providers and trainees, and to offer educational training to our older population and their caregivers enrolled in the OUD awareness program at the UAMS Centers on Aging, the regional UAMS programs, the area agencies on aging, and other rural community clinics in Arkansas. The OPAL program was founded in the response to the national opioid epidemic to address opioid prescribing use issues in Arkansas mature adult populations. This program aims to provide education about opioid pain medications, non-opioid pain medications, and integrative complementary therapies. This program also provides education on OUD awareness to mature adults and their caregivers, updates providers about appropriate and inappropriate opioid prescribing practices for mature adults, updates healthcare professionals with prescribing authorities on OUD in mature adults, and much, much more. I truly want to encourage you to look into our information on these particular programs, as we will provide that information, and encourage you to engage with us as we fight the battle of opioid use disorder throughout the state of Arkansas. Thank you for joining us, and thank you for hearing about Vicara and the OPAL program.
Thank you, Jamal. Thank you for all you do to lead these efforts across Arkansas and for joining us tonight and for those very important words. We really appreciate you being here. Next, we have a very important message from two key leaders in Arkansas's decorated peer recovery support team. First, we'll hear from Jimmy McGill. Jimmy is a certified peer recovery supervisor and spearheaded the development of the Arkansas model of peer recovery, which has gained national attention. He and his wife are the founders of Next Step Recovery Housing, a nonprofit foundation that houses people in recovery. His recently published book, From Prison to Purpose, is a detailed account of his journey to recovery. Overcoming a lifetime of incarceration and 23 years of substance use disorder, author and speaker Jimmy McGill has defied his past and found his purpose. Today, he has assisted in the training of over 330 peer recovery specialists and led the development of the peer recovery infrastructure throughout Arkansas. Following Jimmy, we'll also hear from Michaela Wingfield. Michaela Wingfield is a person in long-term recovery from substance use disorder and mental health concerns. She is employed as a peer recovery specialist with the Division of Youth Services. Located in Little Rock, Arkansas, Michaela travels across the state, empowering youth to overcome the past and strive for a better future. She is active in the recovery community. She fights for the underdog, and her goal in life is to be of maximum service to those in the grips of addiction. She proudly stands with 4 years clean from all substances, and her hope is to raise awareness to the promises of a life of recovery. We're so thankful to hear from you, Jimmy and Michaela, about your lived experience and the amazing transformation you're bringing to Arkansas.
My name is Jimmy McGill, and I'm a person in long-term recovery from substance use disorder. My substance use began with marijuana and alcohol stemming from untreated childhood trauma. As the years went by, my substance use became progressive, and I got into harder things. And before you knew it, I was trapped in a 23-year IV drug addiction. In 2015, I was found non-responsive in a car with a substantial amount of an illicit substance on my person. I was in an empty parking lot. See, from my perspective, a parking lot was a safe place to go and use, a place where I could get the thing that would change the way I feel. Today, I have over 7 years substance-free from any and all substances. I haven't put a chemical in my body since February 27th of 2015. But a lot of people aren't alive to say that. They're not as lucky as I was. I would encourage you to educate yourself on what an overdose looks like, because addiction is fatal, progressive, and incurable. But we get a daily reprieve through a process of recovery. And if you carry Narcan on you, you may be able to save a life long enough for somebody to find recovery, just like I did. People can and people do recover. You know, during COVID, when it was at its peak, everybody carried a mask because the mask saved our lives. But we see astronomical accounts of overdoses every day, and they continue to rise. But yet less than 10% of the people I know carry Narcan on them. And that's not okay. You know, we can, I can, Narcan. We can save a life.
My name is Michaela Wingfield, and I am a person in long-term recovery. But before I got to say that phrase, I was a person that was on marijuana at first at the age of 13. And then I experienced with other drugs that eventually led me into IV heroin / fentanyl addiction. That led me to getting beat up in motel rooms. That led me into 3 rehabs across the state. That led me into 13 overdoses. I've been CPR'd, I've been thrown in showers, all the above. And that was my normal for so long. I didn't want to go through withdrawals. I didn't want to be sick. I was comfortable. I was comfortable getting high in parking lots. I was comfortable in trap houses. I was comfortable doing things to get my drug of choice. Like that's all I knew for so long, until I went to my third rehab and something just clicked. I saw other people recovering. I saw other people happy. I saw other people smiling and laughing. And I was like, I can do that. Like I can be one of those people. I can be a person in long-term recovery. And so I'm proud that I get to say that today. I have 4 years clean from all substances. And I just kind of want to speak on overdoses, like how important it is to carry Narcan around because you never know. Because I was that person in the parking lot overdosing. I was the person in AutoZone overdosing. I was the person that would go behind dumpsters and overdose in bathrooms, gas station bathrooms. But today I'm grateful that Narcan is more accessible than it is when I was overdosing. We couldn't find it. No one was really talking about it. And so I'm glad that it is being carried by a lot of us and a lot of other people. And so it's very important that we carry it wherever we go because you never know whose life you're going to save. And recovery is possible, and I'm rooting for you.
Thank you, Jimmy and Michaela. Congratulations on your recovery, and thank you for sharing your enthusiasm and your passion and your story with us. You are truly inspirational, and we really appreciate you speaking with us today. Thank you. And now, before we turn to show you the VR simulation, well, we wanted to call attention to some of the resources our speakers have mentioned tonight. You'll see on this first slide, you can easily access all the resources mentioned tonight by visiting artakeback.org. You'll see on the next slide, here is where you will find the Narcansaw app, as well as information on Don't Run, Call 911. You'll find instructions on how to download it. And finally, the next slide is a preview of the app with resources and information about opioid overdose and naloxone. Please make sure to take a look at these resources. We've added them to the chat as well. Thank you to all of our speakers tonight. They are all truly inspiring and doing incredible things in our communities. We will now view the virtual reality simulation portion of this event. Walmart has invested in training their associates a number of ways, including using virtual reality. The VR program was developed as a tool for training that was designed to help replicate unique training situations that are hard to replicate in the classroom setting, such as Black Friday trainings and simulations. This technology led to the development of non-retail training, such as the VR we will see today. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it.
You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Walmart team for developing this powerful tool. We're so excited to work with you to connect this to community members. And thank you as well to all of the speakers here today. Special shout out to Kirk Lane and Tanisha Barnes and to everyone who has taken time to be part of this event. Now we have about 7 minutes left and we'd love to get some feedback from our participants with some quick Q&A. I have just a couple of questions I wanted to ask some of our guests tonight. And if you would respond by using the chat, that would be great. I will be monitoring and reading the responses. Before I go to the first question though, I did want to ask, we had a question in the Q&A that said, do individuals leaving jail get naloxone as part of their case management? And I know that we have some folks on for Arkansas. Maybe if you could put in the chat, if you have any response to that. Okay, and if you don't, that is perfectly fine. I would ask the question, please reach out to us at CADCA. You can reach out to me personally, rmendoza@cadca.org, and I will be happy to get you some information on that. It's rmendoza@cadca.org. So on to a couple of other questions we had. We'd love to hear from you guys, your advice. What are some suggestions from the best way that you as community leaders might be able to use this VR simulation tool? And to just give you some examples of some other answers that we've gotten, use the tool just to educate the general population to bring an understanding of addiction and how to help someone or a loved one that's experienced an overdose, help to remove the stigma associated with addiction. And we're really, this is what our goal are with all of these events that we host right now. So if there are any other thoughts, it would be great if you could put those in the chat. And that's not a ton, and that's okay. How about a different one? This VR tool, are there trainings that you have currently that you think that you could incorporate this into? Or are there community events, or could you use this VR tool in your community for events that you might be having? And some advice we've gotten about that is include the training in other languages, which we really liked. Local efforts that people thought this could be helpful in were county and state fairs and health fairs, PTA meetings, church events, college orientations, and when doing outreach presentations. That's great advice. Thank you. Juvenile justice system. Thank you, Janet. Dan, would be great for coalition meetings or town hall setting. And Dan, that's exactly what we really intended to do with that. And you know, then we went virtual, and so we're doing it this way. But we want to get back, and we will be reaching out to you. Hopefully, that we could hopefully do this in person with you at a coalition meeting or a town hall setting. Include captions. Yes, Robert. Great advice, and something that we are figuring out. We agree, and we really want to be inclusive about that. Great feedback. Thank you guys so much. Can you think of other groups that would need this training or somebody that might be interested in? We had casinos, advice that casinos, small businesses. We had high school health class, Cub Scouts and Scout meetings. Any other places that you guys might think would be beneficial for this? And this will be the last question for the night, and then we'll let you all go. Hotels. That's a great suggestion. Thank you. Parents. Thank you, Deb. City council meetings. Really helpful. Arkansas would love to be the first state to roll out coalition demonstrations, specifically with our youth and the way they are engaged in today's world. So Jamal, we'd love to hear that. And you know, we continue to work with you guys whenever we are able to. Okay. Well, this was amazingly helpful. We really wanted to say thank you to all of you who joined us. We want to say thank you to our speakers and our participants for attending this event. We appreciate your time and insight. Please reach out to us at CADCA anytime with more suggestions and questions. Look for us to reach out to you. We will now conclude the evening. We appreciate your time. Have a wonderful rest of the week. Thank you again and have a great night.